other thing, do you guys have that advancer? The clicker, carrying clicker. Okay, I think we'll get started, you guys. So welcome to Rejuv. Thanks for blasting out in the cold tonight. Is there anybody's first timer here at Rejuv? Yes. Oh, majority of people. Okay. Anybody been here before? Okay. One person? Okay. Sounds good. Well, welcome to Rejuv. If it's your first time in the clinic, I'll probably just do a little bit of background about Rejuv and how we got started. I guess that kind of includes my story, how I got started, which goes back a long time ago. So grew up small kid, military kid. Grew up in the military, traveled around a ton as a kid, so went from town to town to town, and which, you know, it's kind of fun, but as a little kid, you kind of don't get this good, stable background. So I learned to be pretty resilient, you know, back in the day as a kid, learned to be pretty pliable and to kind of go with the flow, which, you know, now turning into medicine has been able me to kind of be outside the box, push the boundaries of medicine a little bit, and kind of try to do some more progressive things to make the patients better, and kind of taught a lot as a kid on what to do. You know, went through undergrad and high school and kind of decided, well, you know, actually I was going to be an art major. So if you ever walk through Rejuv and see anything on the wall or anything painted or drawn, that's all my arts and stuff on the wall. So I was going to be an art major. That was my goal, is to be an artist and be creative and to do some creative stuff. But my freshman year of undergrad, I ended up doing an art major as well as pre-med, but I took a summer job as a nurse's assistant or nurse's aide. Has anybody ever worked as a nurse's aide or worked in a nursing home? It's a pretty amazing job. It's a pretty humbling job. You learn a lot about yourself and a lot about where your values are and what you like to do. But one of the patients that I got assigned as a 19-year-old kid was this gal, Barb, who had a stroke. And she was basically in a wheelchair, and she couldn't do a whole lot for herself. So my job as the new nursing assistant was to just basically feed her, clean her, and put her to bed every day. That was my job with Barb. So actually, for the first 2 weeks, it was a pretty boring job. You know, she wouldn't talk to me. She couldn't do much. So I would just talk to her. I'd tell her stories about this girl that I wanted to date, this cute redhead down the road. And eventually I could tell she was listening because she would kind of smile at some of my stories. And so I knew there's something inside there. There's somebody inside there. She wasn't just a stroke patient that was scratching, you know, ulcers into her face. She was a human being inside there. So, but you fast forward to the end of the summer. By the end of the summer, I'd gotten Barb to feed herself. So we took her gloves off. She would tell me stories about her husband, Joe, and how she really didn't like him that much. She would, I'd take her to bed, you know, I'd transfer up, and then we kind of do a little slow dance. I'd put on some music, and we'd do a little slow dance, and I remember I'd be like, Barb, I love you. And she, I love you too. She whispered back to me. Then I put her to bed, and then I thought at the end of the summer, I was like, wow, you know, I really like working with people. I like helping people, and I found that I had a really big heart, that I wanted to do some amazing things with my life, and I wanted to be more involved with people than just being an artist and, you know, creating art. So I told my dad, I said, Dad, guess what? I'm going to change my major. He's like, well, what? Because I don't know if he loved me being a visual arts major. And I was like, well, I'm going to be a doctor. I'm going to go to med school if I can get accepted. He's like, well, that sounds good. So my parents were supportive no matter what I did. So they're supportive of an artist and they're supportive of pre-med. So fast forward 4 more years to, you know, that big day when you try to get in and get accepted. And I remember getting that letter in the mail and, you know, I called my dad on the phone, okay, Dad, we're going to open the letter. And I remember reading the first sentence is like, congratulations, you've been accepted into medical school. So great day, exciting. And the problem is you get through medical school and you graduate and you become a doctor, and I decided to do family medicine because I thought, well, I can reach the most people if I'm a family medicine doctor. And I realized very quickly into that residency that it was just a bunch of prescriptions. It was covering things up. Here's more pain medications. Oh, you need your diabetes. Here's more insulin. Da, da, da. It was 30 patients a day, and it was very unrewarding. I wasn't making a difference in anybody's life, and I was just writing a bunch of prescriptions. And I thought, well, no, this isn't quite what I want to do. So I went back again and did a fellowship in what's called non-surgical orthopedics and sports medicine. So it was more of an orthopedic fellowship, dealing with chronic pain, arthritis, injuries, and trying to get people better from a non-surgical perspective. And shortly into that, it was like, this is right. This is really exciting. This is, changing people's lives, and it was an exciting thing. So I got my first job. After that, graduated for my fellowship and went to Abbott Northwestern. You guys remember when Abbott Northwestern was in town? It was probably 10 years ago. So Abbott Northwestern was here. I was supposed to grow their orthopedic department, grow their physical therapy, and working for this big organization, kind of doing what I was doing and having fun. But again, was seeing tons of patients a day, writing tons of prescriptions, injecting cortisone, and wasn't making a huge dent in those patients' lives. They weren't getting better necessarily. I was covering things up, and they weren't changing their lifestyle. They were still coming back in. They were fatigued. They had no energy. So I went back and got some training in something called functional medicine, which is basically kind of looking at what's happening on the inside of the body, looking at cell health, looking at getting people healthier from a lifestyle perspective, and got a ton of more training and some more newer treatments. Like back in the day, it was called Prolotherapy. Now we do a lot of regenerative procedures like PRP and stem cells, so it's where a lot of that has progressed over the last 15 years. So got into that job, and finally, Abbott Northwestern decided to go back to the cities. So all of us doctors lost our jobs. We had 60 days to find another job and do something on our own. And there was a patient of mine, Susan, who said, if you ever do anything on your own, let me know. I'd love to help you out. I'd love to be your first employee. And I said, oh, wow. So I called, Susan, guess what? We lost our jobs, and I have no place to go. Do you want to start a clinic? She's like, yeah. And I was like, what should we call it? So I just thought, I don't know. Brainstormed for a couple of days. I said, I'm going to call it Rejuv. Rejuv for rejuvenation, bringing life back, regrowth. And so we'll call it Rejuv Medical. So that was it. Called in, got an LLC with my lawyer, and we started Rejuv Medical. And we had 2 employees back then. This was probably 12, 13 years ago. And now we have 75 employees. And we've got locations in the cities, and we're doing a lot of things that are kind of outside the box. We've been recognized with different awards. We go nationally speaking on how to do these types of procedures. I've written a couple books on how to train doctors to be better doctors and how to do these types of procedures as well. So it's I finally found my niche. After all that bouncing around, and I love coming to work. I love treating patients. It's back to that barb experience when I see my patients like, oh, everybody is barb to me. It's making a difference in their life and helping them be the best version of themselves we can be. So shortly into Rejuv, it was me and my nurse, and then I decided, you know what, I need to do something even more. I need to not only make people's joints better, make them feel better, help with their pain, but I've got to overhaul their lives. I've got to get them eating healthy, moving, exercising, losing the weight, because that's going to affect their diabetes, their pain, their back pain, and their arthritis. So I went to Gold's Gym and saw who was the best personal trainer, asked me if he wanted a job, and so he came and started working for me. And we had 3 employees, me, my nurse, and a personal trainer. But the personal trainer aspect of Rejuv was amazing. And so this is our first gym that we had. It was our medical fitness facility. It's just a little room with a couple weights. But what started happening is the outcomes in my procedures was getting better because my patients were not only getting healthier, but then we're regenerating their joints with PRP and stem cells. And so shortly from there, the gym this is 2010, we started renting a warehouse. And then of course, now here we are. You can see where we're at now. Half of our clinic is a gym where we work on fitness, nutrition, health coaching, getting people healthy. The other half is a regenerative clinic. So at the end, if you guys want to come back and tour the clinic, some people can kind of take you around, give you tours. But what's happening is we built Rejuv on 3 big basic pillars, a triad of success. The first thing is, this is what we're known for. Nationwide, people fly in from all over the place. I have people flying in every week from Florida, from Pittsburgh, from all over the place, coming in for stem cells and PRP. The reason we're so good at that is because we look at the entire person. We look what's happening in the inside. Our technique is very in-depth, which I'll get into here in a little bit. But we also teach people how to be healthy, because if they come in, they want me to make their joints feel better, but they're still smoking, their blood sugars are under control, they smell like donuts, they're not going to heal as well. So we've got to focus on that. The other thing is functional medicine. Has anybody ever, you can tell me if you want to, has anybody ever had a functional medicine analysis in their life? So functional medicine means, okay, here we are, we're all middle-aged, we're getting a little bit older. Us guys, we're starting to lose our testosterone. Women are going through menopause, they're losing the balance in their estrogen, progesterone, all their hormones. You might be a little bit tired, you don't have the zest you used to have. There's all kinds of things happening from 40 to 60. We age a ton from 40 to 60. What's happening is your hormones are out of whack, your stomach's not healthy. So functional medicine is looking inside what's happening with your hormones, what's happening with your adrenal glands, what's happening with your stress. It also includes lifestyle medicine, like are you sleeping? Are you eating well? Are you well hydrated? Are you dealing with the stress? Are you doing all those things to keep your body healthy? So a lot of what we do to get our success here is we tune people up on the other sides of things too, which I'll talk a little bit about. Here's me and my family in Minnesota. We love Minnesota. This is kind of the old current, or the old, I call it the old healthcare model. People come into primary care, they're fatigued, they're gaining weight, they're obese, they're aging. What happens is they get prescriptions. They spend 5 minutes with their doctor. Oh, I'm fatigued. Oh, you must be depressed. Here's some Paxil. Oh, my joint hurts. Okay, here's some pain medication. Oh, here's a cortisone shot. This is old style. What's happening in orthopedics, you go in and you say, man, I've got this pain in my knee. Oh, you've got a meniscal tear. You better put some cortisone in there. Oh, it's not working. We better do some surgery. What's happening in community health? Well, our kids, you've looked at the menus. The menus aren't very healthy. What are they cutting? They're cutting phy-ed, right? They're cutting all those things, the movement, and all the things that our kids need to be healthy. This is really the new. This is the current, which I think should be the standard of care, is when people come in fatigued and they're not healthy, is let's look at functional medicine. Let's figure out why they're fatigued. Let's figure out why they're inflamed. Let's figure out why their body's attacking itself. If you come in with bad joints, let's figure out, well, why is your joints breaking down? What can we do to help heal, regenerate, physical therapy, and all those things that we can do to help the joints? And then on the fitness side is we've got to teach ourselves how to eat healthy, how to exercise, how to move, how to sleep, how to hydrate. All those things are super important to create health in our bodies. You know, in medicine, we're trying to do everything with evidence-based. That means everything that we do to our patients, it should have been tested, it should be safe, and it should work well. If you look at the standard care for a knee, an orthopedic position, this is an orthopedic bad meniscal tear or knee, right? It's coming in. This is actually lack of evidence. There's no evidence that NSAIDs or anti-inflammatories help joints. In fact, all the new studies show when you take anti-inflammatories for your joints, it doubles your chance of having a knee replacement. So ibuprofen and levothyroxine are actually damaging to the joints. We know now that like cortisone shots in the joint actually deteriorates cartilage. And how many of you out there, probably a lot of you guys have chronic pain. I bet you almost everyone's had a cortisone shot. If it's in the spine, it increases risk of a spinal fracture. If it's put into your joint, it kills the cartilage. It increases the risk of a knee replacement. Narcotics, we all know the problems with narcotics. It covers it up. People get addictive and does nothing to help with their pain. Okay, nothing's working, so let's go in, let's clip out that meniscus. We're finding with meniscal surgeries, once you clip out the meniscus, your risk of arthritis is going to go up, and your risk of having to have a knee replacement. So we don't want to clip out a menisci anymore. We want to keep that meniscus. It's there for reasons to buffer the cartilage. We want to heal meniscus, not clip it out. And if nothing else works, then you go to a joint replacement, right? So what else can we do? There's a lot of things that we can do besides narcotics, NSAIDs, and cortisone shots. Nothing else is working, then you got to get meniscus surgery or knee replacement. Well, there's a lot of things we can do with nutrition that have been shown. There's weight loss. Different supplements have been shown to be healthy for the cartilage. Physical therapy and different unloading braces to take the pressure off that cartilage. We can do lubricating injections to lubricate the joints. We can do something called Prolotherapy or PRP or even stem cells. All these have good evidence that they actually help those joints and don't hinder and have no negative side effects. So to understand like what we can do to help the body, we also have to have a good understanding of why our body's breaking down, right? If you're going to come to me and you're going to say, yeah, I've got really bad back pain and I feel terrible, I'm fatigued, I've got to understand why and what the mechanism of your problems are. If you look what's happening, prescription drugs are on the rise because most prescription drugs are covering up problems. They're not treating the root core problem, they're covering up the symptom. If we look at what's happening too with our population, we're getting more obesity, more overweight, which leads to more heart attacks, strokes, hospitalizations, more costs of healthcare. Also leads to more back pain, back surgeries, knee replacements as well. The sad thing we're seeing too is that trend is happening in our children as well. So children are learning from their parents and they're emulating what's happening. We're having more obesity, more hypertension, even strokes in people younger than 20 because of what's happening. Type 2 diabetes, which used to be just an elderly diagnosis, is happening in our younger kids because they're getting too much body weight. We know that extra body weight affects everything. It affects our joints, increases the risk of heart attack, stroke, diabetes, hypertension, cancer. All those things are related. That's why half of my clinic is a gym teaching people to be healthy because this is how healthcare reform takes place, right? We know we have less than a year till the next election. There's going to be all this fighting and war and what's the best way for healthcare. The best way to do healthcare to decrease the cost is to make healthy people, is to teach them how to be healthy, how to take the healthcare on themselves and make some healthy lifestyle choices. So when it comes to our body breaking down, there are some things that we can control. So we all have to say we can take accountability for our own health, and there's some things we can control. Now, there's some things we can't control, right? If you get in a car accident, you fall off a horse, you have trauma. Sometimes you can't avoid, you have a birthday, the aging thing happens every year. But certain things we can control. We control our lifestyle. We control what we eat, what we drink, what goes into our body. Do we smoke? We can control our stress, right? You can not answer the phone when you know that friend's calling that stresses you out. You can eliminate those stressful people in your lives. You can forgive people. You can ask for forgiveness. You can do things in your life that changes your stress. We can do things. We talked about anti-aging. We talked about functional medicine. If you're menopausal or if you're a guy that's lost his zest, you can replace your hormones. You can do things to make yourself healthier from a medical perspective with lab testing to see what's happening on the inside. We can actually control our genetics now. We used to think, man, I'm born with it, I'm going to get diabetes, or I'm born with it, I'm going to get breast cancer. We're finding now that you can make lifestyle choices with nutrition, sleep, good hygiene, stress management that change which genes get turned on and which genes get turned off. Arthritis. Most people come to see me with arthritis, so it's good to know what some of those risk factors are for arthritis. Some of those risk factors would be any woman in here that is postmenopausal. Your risk of arthritis goes up because you're losing the protective hormones like estrogen, progesterone, testosterone that protect your joints and keep your bone really dense. So menopause. Of course, we know being overweight, low hormone levels, what you eat affects you. Inheritance. I mean, some people, if your mom had a really bad back, you might have a bad back, so you inherit some of those genetics as well that may get you more prone to having breakdown. Overload, overuse, just work comp type injuries. And then cortisone. Cortisone is toxic to the joint, so we want to keep that out of there because it doesn't do anything helpful. So it's really becoming a healthier crisis. If you look at all the cost of things, the cost of surgery, the cost of medication, the cost of all these things to cover it up, chronic pain is $1 billion industry. Billions and billions of dollars are spent on chronic pain. Unfortunately, it's spent on a lot of things that aren't panning out to be that helpful. Prescription medications, they're on the rise. We're spending about $400 billion on prescriptive medications. Of this list, the one listed in blue, those ones are all based on lifestyle. So we have chronic pain medications, we've got hypertension medications, we've got medications for acid reflux, and we've got medications for diabetes. A lot of those things can be curtailed or eliminated with some lifestyle changes. The problem with opioids, we know it's actually now the #1 leading cause of accidental death in the United States is opioid overdose. But there's a lot of other different ways to treat pain. And the FDA is saying we've got to find alternative ways to treat pain because opioids is not the answer. We talked about anti-inflammatories. This includes Aleve, naproxen, ibuprofen, Advil, all those different anti-inflammatories. People that take those chronically for pain, they have a 2 times risk of progressing to a total joint replacement. So covering up the pain, the problem is those are pretty good pain medications, so you feel better, but it's not healthy for the cartilage. Not to mention now there's new FDA warnings on stroke, heart attack related to taking anti-inflammatories because it works on the kidney, spikes the blood pressure, which increases risk of a stroke and heart attack. So, and that's independent of how often you take it. So those things should probably not be taken as much as they used to. Steroid shots in the joint. This is a large study looking at the effects of cortisone in the joint, and they found that when you put cortisone into any joint, it has a definite detrimental effect at high doses. And the high dose is the typical orthopedic shot in the joint dose. That's definitely detrimental. It shaves down the cartilage and damages the cartilage in the joint. And that study is from 2015, so it's not that it's been around for a while. People know this, but they should not be doing cortisone shots. What about the spine? This was 6,000 patients. 3,000 of those were studied with an epidural steroid injection with your standard epidural dose. When they looked at those 3,000 patients that got compared to the ones that didn't, that had an increased risk of 1/3 for a spinal fracture. And that's because cortisone in the spine actually breaks down the spine and breaks down the integrity of those bones, increasing your risk of a breakdown. Again, steroids put into tendons. When I put steroids into a tendon, it actually causes that tendon to break down and risk of rupture. If I do a cortisone shot into the skin, it becomes too superficial. You actually can get an ulcer because it eats things away. So cortisone has become, it's not a healthy thing for the joints. So in our clinic, we actually really try to avoid that. Now surgery, I send patients to surgery every day, but only if there's a good indication for it. We found that in our clinic, about 96% of the time, we don't need to do a surgical consult, which is great. Now surgery is needed for some things. The problem is with spine surgery, super expensive. Average cost is $80,000 to $120,000, and 50% of those have a high failure rate. So the success rate with spine surgery should be very specific for certain problems. Should not be something that's globally done. We already talked about meniscal surgeries. Studies with that show they're no better than placebo at 1 year. That means if you do it, a year later it's no better than if you didn't do it. But there's a definite increased risk of knee arthritis once they clip the meniscus out. So really what we need to do when it comes to chronic pain, arthritis, degeneration, is we need to tip that scale from degeneration to regeneration. So things we need to start avoiding is unhealthy lifestyle. If you're not sleeping 7 to 8 hours a night, you better start sleeping. That's when the body heals itself. Get our hormones balanced. Look what's happening with our body weight. Look at our genetics. Avoid NSAIDs and cortisone. Things we can focus on that are going to tip the body into a regenerative state is healthy lifestyle, functional medicine, looking at the hormones inside our body, getting fit, exercising. And the things we'll go into some more detail later on is going to be PRP, stem cells, and different things we can do actually with our nerve health. So my book, Regenerate, has anybody read it yet? One person in the back. I'll sign it for you. But anyways, this was a labor of love. This is kind of a accumulation of all my passion and all my love. And basically I put into it a little bit of everything the body can possibly do based on evidence to heal itself. So it goes a lot through nutrition. How should a person eat, not just to lose weight, but to heal the body? avoiding the bad toxic fats, and all the good fats should be eaten, and all the good proteins and vegetables and fruits. Talks a lot about, lifestyle. How do we sleep? What's good sleep hygiene? How can I get good hours of sleep? It also goes into some detail on what's PRP and stem cells and those types of procedures. Oh, this is fun. So this next slide, I think it'll play, is anybody, like the Minnesota Vikings? I love football. I love watching the Vikings. And does anybody know Ben Lieber? He's a past football player for Minnesota Vikings. Now he's kind of a celebrity. And he was just voted last week as one of the top 100 influential people in Minnesota. So he's a cool guy. Kind of a friend of ours at Rejuv. And he came in a couple years ago for stem cells. And it's kind of fun to see his experience. Can you hear it? Be quiet.
So I've come to Rejuv to do a non-surgical procedure to take stem cells out and throw that in my knee and hopefully get some cartilage removed on my knee.
Is anybody squeamish? There are pictures of needles on here, so be careful. That's actually PRP there. He's pretty relaxed, just texting, talking to his agent. I gotta get an agent one of these days. I'm just kidding. He had a PCL, posterior cruciate ligament sprain too, so that's why the injection was from the backside.
The actual taking the harvest and putting it into my knee was one of the cooler experiences I've ever seen because it's done under ultrasound, so I actually get to see Dr. B and his needle go into my knee, and then because the stem cells kind of shimmer a little bit, I think that's because of the fat that's involved, you could actually see it being put in your knee and it kind of dances once I kind of makes the dust or something. So it was kind of cool to see. So you can actually see it go into your knee, and then there's a full complete process that's happening, and that was really easy. Overall, it's been a good experience.
Yes, then here he is, a couple months later. He went out and he was walking his dog, and he hadn't been running for years. And then he went out and started downpouring on him, so he actually ran all the way home like 2 miles. That was the first time I've run in a couple years, and he realized, oh, my knee doesn't hurt. And then, so anyways, he's doing really well. Somebody overheard him on his radio the other day saying, oh, my knees still feel really good after stem cells. And this was like 3 or 4 years ago, so he's still doing well. I always feel tiny when these football players come in because I kind of stand up and I'm like, it's just like, they're so big. It's kind of fun. So the other reason we have a lot of success here is I put together kind of this mnemonic, and that's what I'm going to go into today. It's called the CFAN model for optimal healing. And our goal with the CFAN model is to really isolate the cell health, make sure people are really healthy on the inside, that I can work on their functional movement, I can regenerate their joint using stem cells or PRP with their nerves. So joints break down. So say I'm a football player, right? I'm running and I cut and I pivot and somebody tackles me from the side and I sprain that MCL. So I get a ligament sprain on that inside ligament here. So here's this football player, right? He's running, he's cutting. He sprains that ligament over there on the side. So the ligament becomes slightly unstable. Now young kids, football players, they're healthy, feels good after a couple weeks. He goes on and finishes the season. But now he's 30 and he comes to see me, and that joint that he sprained back then, because that ligament never tightened up enough, he's got degenerative arthritis in this knee. His other knee looks perfectly normal. Usually there's some kind of a trauma, overuse, or something that starts the degeneration in the body. When that instability takes over and things kind of progress and continue to break down and slide, that joint kind of grinds itself down. So we have to address instability as well when we're trying to regenerate these areas. This is an example of a low back. So here's a normal low back. This could be a fall, could be a car accident. The body goes into kind of a dangerous kyphosis. The body goes forward and it sprains all these ligaments. When these ligaments are sprained, 4 years later, because that back is unstable, it's sliding around, they're getting degenerative discs. Their discs are sliding out. The joints are grinding down. That back is breaking down faster because that trauma has loosened up the back. It'd be like if you're driving your car, right, and you plow into the curb, and that front tire on the left gets kind of wobbly. Well, that tire is going to wear out a lot faster than your right tire because it's just unstable. It's got a lot of abnormal movement, which is degenerating the tire, the cartilage, or the rubber. The goal is to regenerate that and turn back the clock a little bit. So how can we do that? How can we affect the articulation of the joint? 15 years ago, we couldn't. We're like, there's nothing we can do. So we did do a lot of cortisone shots. There was nothing we could do when we'd get people stronger, but the joint would continue to degenerate. Now with the use of these biologics like PRP and stem cells, we can actually turn back the clock and regenerate, stabilize, and help those ligaments and cartilage get better. These procedures started way back in the day. This probably was 40 plus years ago when we started doing Prolotherapy. Has anybody heard of Prolotherapy? Anyone? Prolotherapy is just concentrated dextrose. So it's a very safe, very cheap injection to do, and it uses a concentrated dextrose, and so I'll talk a little bit about that. So prolotherapy, the definition of prolotherapy is the rehabilitation of an incompetent structure, like a ligament, a tendon, or a joint, through the proliferation of new cartilage. So you inject concentrated dextrose, and what dextrose does when it goes into a joint or a ligament is it's actually an irritant. So when it goes into the irritant, it's creating micro-injuries into those areas. The body senses that micro-injury and sends its own healing cells, so it sends its own platelets and or stem cells to that area. So you're kind of making fake injuries with prolotherapy. The body goes back and re-heals it. So this is what we started back when I was in my sports medicine fellowship 15 years ago. This is what we started using as a non-surgical treatment. Now since then, things like PRP, has anybody heard of PRP or platelet-rich plasma? That's gotten a lot more press because a lot of national people are getting it. Football players, athletes get it, so it becomes more nationally known. PRP is a simple blood draw. You take out the platelets, you spin it down, you separate out the platelets and the growth factors from the blood, and you re-inject those healing cells right back into the injury, the degeneration, the ligament, the meniscus, the tendon, and that ignites, again, a healing cascade, gets the body to come together. So the body does have ability to repair itself, right? Say you go for a run and you sprain your ankle, you basically tear those ligaments. What happens? It turns black and blue, it swells up, it looks ugly, and you're gimping for a while. But 6 weeks later, I'm actually running again. I'm happy because my body repaired those ligaments. I did nothing. You can avoid ibuprofen, by the way, with those because ibuprofen with those injuries slows the healing process down. So don't take ibuprofen with acute injuries. But PRP is kind of mimicking that mechanism of sending platelets to the area. So we do the blood draw, take out the platelets, put it into your area of degeneration. It starts up that healing cascade. And it does that through different growth factors. When a platelet binds to something, it actually pops open and releases growth factors. Those growth factors increase blood flow, new blood vessel formation, cartilage formation, soft tissue formation, helps the body heal. And then the newest kid on the block is stem cells. Now, stem cells have been around for probably 15 years. It's been used in a lot of indications, and the goal with stem cells is to take the body's simple stem cell and use that cell to get the body to heal. Stem cells that we use here all come from bone marrow, so it requires a bone marrow harvest to tap those. And there's a few different ways you can do stem cells. You can do it from bone marrow, you can do it from adipose. Some clinics are touting that they're doing stem cells from a vial of like amniotic stem cells or embryonic stem cells or placental stem cells. I'll get into a little bit of what that really is because it's not actually a true stem cell. The two real big competitors on the market right now are bone marrow versus fatty tissue. And when you look at all the studies, the bone marrow actually is probably the most efficacious and the safest to use. This is a good study that looked at all different types of stem cells we can get. Big ones were bone marrow, adipose. They also got it from muscle, the periosteum, and around the heart. And they found that the bone marrow-derived stem cells had the most ability to reproduce cartilage, which is what we're looking for with arthritis and degeneration. So bone marrow has also been shown on safety studies to be much safer than the liposuction that get the fat cells. So bone marrow is much safer. What we do not do here is we don't do placental, amniotic, or embryonic. Because if you look at really what that is just a bunch of debris in a little vial. It comes in a little vial. It's super expensive to get. And if you have to add water to reconstitute it. I guarantee you when you add water to those, it does not make them come back alive. It's still very dead debris. We look at the studies that show what it is. When you look under a microscope, it's actually just a bunch of debris. So if anybody's trying to sell you stem cells in a vial from a placenta or embryo or amniotic fluid, it is not stem cells. And the FDA is actually really cracking down on those clinics and actually shutting them down because it's kind of fraudulent advertising to do that. It'd be like for you to go get your kid, a nice new goldfish. Would you rather get him a nice healthy goldfish or a dead fish? It's just less fun to play with that dead fish. So the question I always get is, how do stem cells work? This is pretty interesting because stem cells are basically a cell that has the ability to form into something else. So a stem cell does not have a name until it binds to something, and it can turn into that cartilage. It can turn into bone. It can turn into soft tissue. It can turn into whatever it kind of binds to. So how they work is when that stem cell goes in, it sees something as being injured, it binds to it, and then it starts to do a bunch of stuff with those cells and starts to help the healing by a lot of different ways. The first thing that the stem cell does when it binds to that injured cell is it transfers over its mitochondria. Does anybody have a science background or heard of a mitochondria? The mitochondria is the powerhouse of the cell. So it's like the battery. So the first thing it does is the stem cell binds to it and says, oh, this guy's weak, transfers over its battery so that that stem cell or the sick cell now has more power and ability to make ATP, which is the energy source for that cell. The other thing it does, it gets into the environment and the stem's like, wow, this joint is inflamed, it's going crazy. The macrophages, which are cells that are supposed to clean up debris, in a lot of arthritic joints are overactive. They're actually devouring all the healthy cells as well. The stem cells say, hey, just chill out. Let's stop devouring the good stuff. And it tells those macrophages to start making healthy cells again. The other thing it does, it's called Paracrine Signaling. This is almost like a hormone thing where the stem cells come in. It binds to that unhealthy cell. It's like, whoa, man, this guy's really needs some help. So it actually signals for help. It says, okay, I need some help. I can't do this alone. So it's like the cop coming to the thing and saying, whoa, I need some backup. Somebody come in here and back me up, and then everybody else comes in and helps him. That's what the stem cells do. They bind to the unhealthy cell and says, well, I can't do this on my own. So it tells the body to send more healthy stem cells and platelets to help recruit and heal that area. The other thing that it does when it binds, it not only transfers over the battery, but it transfers over what's called messenger RNA. Messenger RNA is basically the template or the recipe that creates healthier protein. So it transfers what's called an exosome over across the membrane and says, okay, this unhealthy cell, you got to start cranking out this good protein. So it basically gives it a recipe to create better protein again. So to comment summary, when a stem cell goes into a joint, it reduces that destructive environment, reduces the inflammation, restores that healthy joint communication so it can recruit other healthy healing cells to help it out, and it returns homeostasis, and it tells that destructive joint to go back to a regenerating joint. I like this slide here because after, remember Ben Lieber, he said, when I watched it, it kind of looked like fairy dust and pixels kind of going down, and it kind of does. Every time he said that, I always think of fairy dust because this is the joint. This is done with ultrasound. So every time we do the injections, we either use ultrasound or fluoroscopy to guide the needle to make sure that the stem cells or the product is getting to the right part of the joint. This is the joint of the knee, right? It's that round kind of curved surface that kind of hinges. Here's my needle coming in here. Then you can see this kind of white glistening pixie dust coming down there and it's kind of recoating that joint. So this is the actual stem cells going down. You can see it kind of sticking. Then when you pull that needle out, you see this nice glistening layer. Those stem cells are kind of sticking to that cartilage. So this is actually really fun to watch. So the evidence behind this stuff. So evidence, when you think about prolotherapy, that first, just the dextrose injection, there is a lot of level 1. So level 1 is the highest amount of evidence that you can have for a scientific study. This is all level 1 evidence that shows that even just prolotherapy, which is concentrated dextrose into those joints, helps with arthritis of the hand, the elbow. A lot of studies done on the knee. PRP has been studied on the spine, knees, hips, joints. It's been shown to increase cartilage growth. And this is kind of a trial looking at, has anybody had a lubricating shot before? Like the lubrication of the joint? Just shows that it's superior to lubrication. Stem cell evidence now, there's studies on the knee, rotator cuff, hip, low back, ACL. That stem cells can help repair all those areas. Here's a study that shows that stem cells put in the joint increases cartilage and meniscus volume when injected. This is a treatment or another knee study looking at stem cells from 2013. So again, it's been around for a while. This one just shows that it's very safe. It also increased the quality of the cartilage. This is another knee study in arthritis of the knees, showing positive benefits in the knees. This is one of the original studies of 2008, and what they concluded based on MRIs. So they did MRIs pre and MRIs a year after stem cells were transplanted, showed cartilage growth, decreased pain, and increased range of motion, which is really what people are looking for. Decreased pain, better function, and better quality of life. So it's interesting, about 5 years ago, Rejuv was about the only place you could go get stem cells at. There wasn't a lot of places in the tri-state area. So now Mayo Clinic is doing it, which is good. It gives good reputation to it. University of Minnesota's got a big research department. Sanford Health, which is from South Dakota, kind of coming through Fargo. It's a big healthcare system moving this way. They have a big research department on stem cells. What makes us a little bit different is not just the fact that we're injecting stem cells in the joint, but it's one, how we inject it, and all the other things we do before and after the procedure to optimize those outcomes. And so we kind of take 3 things into mind here. We look at what's very innovative in these things. We integrate our stem cells with those things we talked about, the cell health, getting people healthy, the lifestyle things. When you do that, it really optimizes your outcomes. It gets the outcomes of the stem cells to last longer, and it gets the growth and the potential of the healing to be higher as well. So some of the things we do is we do our own lab processing. So most places when you go to get your stem cells done, they'll do the bone marrow harvest, and they take that and they just put it into a centrifuge, and it's a kit. It kind of spits out their product. Where we actually have a lab with 2 hoods, and we have people that are trained to pipette and do all the hand processing, which means we can be much more accurate, get better cell quality. We can do a much higher volume as well with our processing in the lab. When we inject, we use image guidance. That last one you saw the knee, that was an ultrasound. This here is also ultrasound. This is an ultrasound showing this rotator cuff tear. So it's important to see the tissue, because if I'm going to try to get that rotator cuff tear to heal, I've got to be able to deliver the transplant or the stem cell or PRP right into that tear to get it to heal and come back together. We also use a lot of kind of variations on the PRP, and so we use the stem cells, which is basically you take the stem cells out, you isolate them down. We use both the fat layer in the stem cell itself and the stem cells. This is the lab processing thing. But then when it comes to the PRP, we can, because we do our own processing, we can super concentrate that PRP. Most people's PRP is about 4 times concentrated. We get our concentrations up to 10, 14, sometimes 20 times concentrated. It means those platelets are very thick and like almost pasty, but you want those concentrations high to get more cells and more stimulation there. The other thing that sets us apart is, again, like I said, I've written 2 books on how to do these procedures, and so those books are used by a lot of organizations as their training manual. But when it comes to me teaching another doctor how to do a knee, most places just do a simple shot in the joint, and it's okay. We just did your stem cells, hope you get better. Whereas you can see how there's probably about 15 to 30 different places that I will inject and put the platelets and the stem cells into a knee, because the knee is a very complex structure. Same with the shoulders, one of the most complex things that we do, because there's 4 different muscles attaching there. You have a labrum, you have ligaments, you have fascia, you have capsules, all kinds of things that have to be injected to tune that joint up. It's not just a simple shot in the joint, because these procedures are only successful if those cells are precisely delivered to the tissue that's degenerating. So it's a very complex type of procedure. This just kind of shows what it would be like to come in for a stem cell procedure. A patient might come in, have a consultation with me tomorrow, and be, okay, yeah, you've got bad arthritis in your knee, and here's what's happening. Okay, you want to do stem cells, that's fine. Let's put that out about a month out, because I want to make sure that we get you prepped up for that procedure. So what we'll do for a month is we'll start them in physical therapy. They'll start doing some physical therapy. I'll get them what I call Rejuv for Lifestyle. It's just a card that gets them access online. I have them read my book, teaches them lifestyle, weight loss, nutrition, all those little secrets to get them healthier. We'll get them some supplements that have been studied with cartilage and cartilage volume and stem cells to be healthier. And then they'll come and see me here. And they're already feeling good. They're lost some weight. Their energy is good because they're doing all the right stuff. They're sleeping well. And then our stem cell procedure are these 3 middle, is this blue? I'm colorblind, but whatever these 3 little colors are. This is the stem cell procedure. It's not a single day. It's actually 3 separate days. So like this week, I've got patients going through the procedure, but it's like a Monday, Wednesday, Friday experience. The Monday is a prep shot in the joint. It's kind of like if I'm going to put paint on my wall, real expensive paint, you want to put a primer on first so your paint sticks better to the wall. So we do a primer injection into the joint. It's almost like you're prepping the soil and getting it ready for to plant the seeds. And that's done with that Prolotherapy. That concentrated dextrose solution goes in the joint, irritates the joints a little bit, so that when I plant my seeds in there on day 2, those stem cells have a reason to stick and start to grow. So we do a dextrose solution that irritates the joints a little bit. That irritating joint signals that stem cell when it comes in to bind and start that process that we talked about. Then you come in on day 2, which will be 2 days later, and that's we'll do a bone marrow harvest, and then we'll inject that stem cell into the joint or the large tendon tear. 2 days off, you come back on the last day, and then we do a full PRP. We draw the blood that last day. We inject some of those platelets into the joint that has the stem cells to fertilize those stem cells and get them growing. And then we inject the rest of those platelets into all those other structures you saw on that knee exam, or the knee page there, the ligaments, the tendon, the coronary ligaments, the muscle attachments, the fascia, the retinaculum, to get all the rest of those structures in that knee to start healing. And then you go off for a very specific post-procedure protocol, which means you'll go to my physical therapist. You'll see them weekly. They'll advance you very specifically along that protocol to keep you advancing. People will continue to do their supplements. We'll talk a little bit about peptides and how peptides can enhance the healing process here coming up in a second. Sometimes people will do regenerative IVs afterwards with a bunch of different healthy vitamins that just help the body repair, and they'll continue doing those supplements. One thing, if a person comes in to see me on this day and they're like, yeah, I want my knees to feel better, but like, yeah, I'm in menopause, and I'm super tired, and I don't sleep very well, my testosterone's low, or my estrogen's off. Well, sometimes we'll do what's called a functional medicine or hormone consult, and during this time frame, get those hormones and everything optimized, and then when you start doing the regenerative stuff, your outcomes are much better because your body's ready to heal from an internal perspective. So the rest we'll kind of go through here a little bit. Next is kind of cell health. I don't have to spend a ton of time on this, but cell health is really the rest of the story. It starts with this. It starts with your mindset. And this is in the gym. It's in the clinic. If you come in and you have the mindset of I can't, or it won't happen, or I'm not ready for this, or I'm not motivated, or I'm not going to take the lifestyle challenge on, we've got to fix the mindset. Once you've done that, we can improve your fitness and your nutrition. We can get your body composition better. Hormone optimization, all those things we can do to get you better. And everybody coming in gets a little card. And the card it's just an online platform to take them through all the nutrition, breathing techniques, eating, how much hydration should I do, sleeping techniques, and then how to move well, which is somewhat physical therapy does as well, how to move for healing and regeneration. We talked about how mindset is so important. Breathing is really important, deep diaphragmatic breathing. Nutrition is super important. I'll go through nutrition here in a little bit more detail. Drinking a lot of water. Water detoxifies and purifies the body, is mostly water. We need a lot of water to keep the body functioning well. Does everybody sleep 7 to 8 hours a night? It's important because that's when your body heals. So when you go to bed, your body starts to sleep. Your body kind of then can focus on the healing aspect. It releases growth hormone, releases good healthy hormones that heal the body. During the day, it's too busy to do the healing process, so it's really important to sleep well at night. Movement's important. This is a great story. We do a lot. A lot of, like I said, her mindset was really strong and she was able to do a lot of good things. Nutrition is very important. We know the standard Western diet's not the most healthy thing with all the vegetable oils, flours, and sugars we're consuming. We put everybody on, it's not really a strict, we try to keep the nutrition plan a little bit open. So not everybody goes keto, not everybody might go vegan, not everybody's going to go vegetarian. We're going to make it kind of flexible. There's a lot of different ways that you can eat that is healthy. But we break it down in basically 2 categories. It's going to be non-ketogenic or ketogenic. Has anybody heard of keto or the keto diet or ketosis? And to lose weight, at some point you have to be in ketosis. You don't have to be doing the full-fledged, I eat fat for everything, but you have to get the body burning fat to lose weight. And the only way to do that is to dial down your carbohydrates. And to do that, I put into 3 different kind of, if you're trying to lose weight, you can do your foundational nutrition. And with foundational nutrition, basically it's about 100 to 150 grams of carbohydrates a day. You're going to basically maintain your body weight, or you might lose half a pound a week or so of body weight. The average person probably consumes 200 to 300 grams of carbs a day. So 100 to 150 is, you got to be careful about what you're eating. Now, if you want to have a little bit accelerated weight loss, then we do our accelerated nutrition program, which means you're going to dial your fats down to 50 to 100 grams of carbs a day. If you do that, your body's going to burn up those carbs. It's like, I still need some energy. Then you're going to go into ketosis and you're going to burn the fat. So you got to dial down the carbs. Now, advanced nutrition, where you almost want to have a life coach or a health coach help you, this is true ketosis, where you're almost eliminating all carbs. You're increasing your good fats, not all the junky vegetable oils and all the bad fats, increasing the good fats. Now, here's an advanced weight loss program where you're going to lose, 3+ pounds a week, but it's very dialed in. You've got to, really dial down those carbs. But I like these first two. It's slow, it's steady, it's doable. You can cheat here and there, but it's going to continue to decrease the body weight. One thing when it comes to stem cells is intermittent fasting. Has anybody ever tried intermittent fasting? Intermittent fasting is where you basically don't eat till 1 o'clock, 2 o'clock, or just skip breakfast. Some people do like a 3-day fast where they just do water for 3 days. But when you get into that fasting state, the body upregulates all the healthy healing hormones. It regenerates, it resets a lot of set points in the body. So fasting is really important. I try to fast every day, at least during the week, till about 1 or 2 in the afternoon. What we find with stem cells, though, is fasting has a positive influence on stem cell function, increases the viability in the number of stem cells when we do our bone marrow harvest. Very important. The next thing to talk about with cell health is we talked a little bit about hormone optimization, which is looking at that whole symphony of hormones. What's happening with the adrenal glands? What's happening with my testosterone? Like, man, I'm really fatigued. I can't think straight. I'm really forgetful. Well, dude, your testosterone's really low. Or the female's coming in, she's like, oh, I'm hot flashing. I have no energy. I have no zest. I just have no motivation. Yeah, you have no testosterone. Your estrogen's super high. Your progesterone's super low. And you have no adrenal function. Your thyroid's off. Well, there's a reason you feel that way. It's not just, okay, that's because of menopause. It's because there's things we can do to get you that zest back, to make you a 9 out of 10 in energy again. But it takes some work and some lab work up and some work on your health side, your side as well. Moving on to functional movement, our goal there is to make people stronger, more flexible, and to make sure that their fascia, the fascia is what connects everything, is healthy as well. Sometimes, and I consider this functional movement as well, if you're developing arthritis on one side of the joint, the outside's really healthy. You can see this is a before and after picture of just simply putting an unloading brace on. You can see when you put that brace on, you dial it up, they've got a lot more space now. And if I'm going to try to get this cartilage to get healthier here, you got to take the pressure off for a little while. And those braces are great because it opens up the joint and allows a little bit of air in there so you can kind of grow some stuff. It's like planting a garden and throwing a bunch of 2x4s in your garden. Well, nothing's going to grow unless you give it some space. So you got to open it up a little bit. Other things we do when it comes to functional movement is a lot of physical therapy. Sometimes we teach people how to do some foam rolling. Sometimes we do a little bit of manipulation, getting things back into alignment so fascia and everything flows better. Bracing is important. And we can also, if things are unstable, if you have dysfunctional movement in that spine or that knee, you can use Prolotherapy or PRP to tighten up those ligaments a little bit. The final thing I'll touch base on here is just nerve health. Nerves are our source of pain. If we had no nerves, we'd have no pain. So when people come to assess me for their joints, their spine, I've got to also look at the entire nervous system to see what nerves could be causing pain. So if somebody comes into me with shoulder pain, is that pain coming from their shoulder joint? Is it coming from the ligaments? Is it a ligament tear? Is it a labrum? Is it coming from the neck and the pinched nerve of their neck? Is it coming from a pinched nerve around their shoulder or coming through the muscles around their shoulder? So pain in the shoulder is very difficult to diagnose because the differential diagnosis is very broad. Same thing with low back pain. Oh, I've got low back pain. Well, it's not necessarily everything that's on your MRI. There's a lot of other structures that we don't see in MRIs that can cause back pain, including these little peripheral nerves. Hippocrates said, look well to the spine for the cause of disease, right? This is years and years ago, but he was very wise. He knew that nerves can cause problems. This is interesting. So in the late 1800s, there was an anatomist. All he'd do is spend a day, he's kind of a dark guy, just dissecting people and looking at the anatomy. But he started finding that every nerve that goes past a joint sends a branch of that nerve into that joint. So nerves have influence on what's happening deep inside that joint. They send information into the ligaments, the muscle, the tendon, the labrum. So what we're finding is that nerves can influence function in the things they innervate. Carpal tunnel is a good example of that. It's a compressive syndrome of the median nerve that can cause atrophy and dysfunction in the hand. There's over 30 different compression syndromes in the body where nerves can be compressed. So if somebody's coming to me with back pain, I've got to decide, is it a compressed nerve? Is it a disc? There's a lot of things that can cause pain. So you've got to make sure you're treating the right thing. The problems if nerves continue to be compressed is they start to release two things, substance P and CGRP. And this is where if you're kind of a bio nerd, it gets really exciting and interesting because these two things have biologic influence on the body. The CGRP, so for example, if I've got a nerve in my shoulder that's chronically compressed, that nerve, if it's compressed too long, doesn't have a good blood supply to it, starts to release these inflammatory peptides. And the problem with these inflammatory peptides is they cause influence on the body. And some of the things they cause is this, neovascularization, which is just abnormal blood flow. And so sometimes I can do an ultrasound. You see all that sparkly stuff? That's just abnormal blood flow that shouldn't be there. That's the body potentially going to break down. When the CGRP gets released, it causes collagenolysis. Well, that's not good. Collagen lysis is collagen breakdown. That's what's causing those tears in my Achilles tendon or my rotator cuff is because the collagen is breaking down because the negative effect of that compressed nerve. So if I don't decompress this nerve, that's going to continue to have a negative influence on that rotator cuff tendon. So again, when I go to regenerate these tendons and stuff, if I don't decompress these nerves that are affecting it, it's going to continue to break down. It also causes calcification. You don't want the body healing with calcium. That's called calcific tendinosis. And that's not a healthy way to heal. Calcium in ligaments can be caused by compression of the nerve and the release of this abnormal hormone. So what do? What you have to do is you have to go in there, you have to find the nerve, which we can see with ultrasound. We do a lot of different injections that are very precise, and we release those compressed nerves, whether they're compressed, whether it's the shoulder, the spine, an epidural, the carpal tunnel. We release the pressure off that nerve through what's called a hydrodissection technique, which I'll show you here. And this is just a study on that hydrodissection technique at Mayo, showing that going in with an ultrasound in a solution made of dextrose or mannitol, a sugar-type solution, can decompress those nerves without having to do surgery. This is what it looks like. You're coming in. This is the median nerve getting compressed in carpal tunnel. Here I'm coming in with a needle. You can see me dissecting that needle away from all that webby, kind of scar tissue. And what it's doing is it's freeing up that nerve. Now you can see that nerve is floating freely. So it's no longer getting stuck in that carpal tunnel, and the normal impulses can get down to the fingers. We do that same technique with epidurals. We can do different pelvic nerves for pelvic pain. We can decompress these nerves, and it's very important to do that because you know what? That person just needed decompression of their, they didn't need anything else in that hand. Now the pain went away. We also do not like cortisone in the spine, right? Well, what can you do for a compressed nerve in the spine if you can't shoot cortisone in there? Well, new studies are coming out showing that you can inject dextrose, we call it a sweet epidural, into the spinal space, and it's safe. It's more efficacious than steroid and doesn't have those negative effects of spinal fracture. So we do a lot. Today I think I did 8 or 9 of these just because it's so easy, it's so helpful, and it doesn't cause any damage to people. So when it comes down to this, you have to be innovative. You have to follow the research. You have to combine what's best for the patient. You have to be integrative. That means we have to take what's best from lifestyle, from cell health, to movement, to the joint, to the nerves. Bring them all together. When you do that, that's when you get these optimal outcomes. And I think this is just one more little story.
Hi, my name is Mary Vanderweis. I live in Big Lake, Minnesota. My story is I have spent many years working at a desk where we did not have an ergonomic workstation. And I started getting headaches. They started about 8 years ago. However, the last couple of years, they've gotten more frequent, more intense, where finally I was having them. Maybe I would have one day off out of 14 days. I had no life anymore. I couldn't go anywhere, do anything. I spent over $8,000 out of pocket on chiropractic, Chinese medicine, including acupuncture, acupressure, cupping. I did anything I could think of before I turned to the medical side. Then I have had, before I came to Rejuv, I have had 5 different sets of nerve blocks, a radio frequency ablation. There's just been no relief at all, none. So I started coming here only 4 weeks ago today. I have had 2 sets of nerve blocks, the second one being today, and 22 days ago I received the PRP injections. I don't know which part of it is working, but it's working. Today I'm on day 5 without a headache, and that's amazing. It's changed my life. So anyway, if you're watching this, hi,
So I love my job. That's like my barb. Every time I see patients and they tell me these stories and I get emotional, they get emotional. It's what we do because we know what's right for the patient. And but we'll open up for a couple questions. We have a couple minutes. If people have any questions on anything or if anything's not clear, just let me know. Any questions?
So if you inject the stem cells, is there a point where you don't want to be like, say a knee, you don't want to be on it? I mean, does it need some time before we're starting to go back to work and do?
Yeah. So to me, it's like kind of planting a new, bed of grass in your yard. So you got the soil, you plant the seeds. So you're not going to let those grandkids go play in that grass until it's matured a little bit. So we do have a post-procedure protocol that's very strict with knee arthritis or shoulder issues or low back problems. And basically with the knee, the first 3 days, I put you on crutches, and I put you in that unloading brace depending on where the arthritis is at to open up that joint. And you're not going to put a lot of weight through it for about 3 days because I want those stem cells to stick, to bind, and kind of start their process without being sheared down or too much stuff going on. And then on the 4th day, you can put a little bit of weight through it. So you're starting to walk a little bit. By day 5 and 6, then you're basically dropping the crutches. You have about a 5-pound weight limit for the next week. So you can go around, do office work, light stuff, carrying light little things. Second week, it's a little more progressive. You're seeing physical therapy. They're starting to work on some strengthening. 3rd, 4th week, a little bit more. By the 5th or 6th week, you're back into normal lifestyle activities. So it's usually about a week of modified downtime. So I tell people don't schedule before a big vacation. Make sure you can just kind of chill out. You don't have to do a lot of traveling or carrying anything heavy for about a week. Yep.
How many people, if you have 10 people, how many successes out of 10 do you have?
We have about a 90 to 95% success rate. And that's because we are very good at making sure what we do is picked for the right person, and that we figured out why is your back or your knee painful, and we're treating the right things. And so what we find probably the biggest reason for failure is non-compliance. That means the person's not sticking to the nutrition plan, they're not doing their physical therapy, or they do too much too soon. So that's why over the years we've developed a very strict week 1 list. Even if you feel really good, pull back in the reins. So a lot of people just like to ride that pony and go fast. You got to keep pulling back in the reins and stick to that protocol. It's really important afterwards too to stick to the lifestyle changes, the nutrition stuff. All those protocols are really important. So we have a really good success rate. We're probably part of, so with our lab processing that I talked about, that's part of it's called Regenics. So we've got a proprietary way that we do all the stuff in our lab. That is just what we do here. There's about 60 clinics around the nation that do that. And all of our data goes into one big data bank. That means all of these clinics are studied. We look at our outcomes. We look at any complication rates. We look at all of that. And our clinic location right here has the highest outcomes in all of our procedures of all these 60 places. So I think it's because we're meticulous with detail. We look at all those different structures. How we inject is very comprehensive. But then we're also looking at what we do beforehand and afterhand to have those good outcomes.
So you're getting the stem cells from yourself?
Yep. So it's an autologous stem cell, so it all comes from bone marrow, and the easiest way to get that is actually from the pelvis right here. These bones are pretty superficial in most people, and you just use the ultrasound and you take it out right from there. And it's most people tolerate it very well. They describe it as maybe a 2 to 4 out of 10 as far as discomfort goes. And then afterwards, that little area just feels like you got hit by a baseball for a couple days, a little bruised.
What if that's the area that's giving you trouble?
Well, the area that we take it is kind of not a dead zone, but you probably have a lot of SI issues in the SI joint and pelvis. So we're not taking it from that area. We're taking it from the wing bone. So if you have a lot of SI issues, usually we don't even have to use stem cells for low lumbar SI problems. We use mostly PRP for that. So usually our stem cells are done for all of our peripheral joints, like for knees, backs, hips, shoulders. And PRP is actually powerful enough to do the spine. We really have to do stem cells on the spine. It's usually a PRP.
What does insurance cover? What doesn't cover?
So it's changing a lot over the last 10 years. It's kind of interesting. Way back, 10 years ago, everything was covered. And then everything became politics because there's a lot less orthopedic surgeries being done. So then orthopedic surgeons took the code, the PRP code, and said it's an experimental code. But now over the last 5 years, it's all changing. So what's happening now is all the self-insureds, they want to cover it. So I just went to last week, I can't tell you who, but 3 big companies, kind of like Best Buy type companies, Target type companies in the cities, and we presented to them the benefits of those large places covering it. So now in Minnesota, Hy-Vee grocery store chain covers it. Minnesota Railroads Association covers it. Minnesota Teachers Association is getting very close. Good Samaritans Christian Insurance covers it. There's another optical company that makes optical lenses. They all cover it because what they're finding is when they cover these procedures for their employees, they save about 80% of their healthcare dollars. A lot of them are mandating that before we will actually pay for your spine surgery or your joint replacement, you have to have done stem cells first before you're even going to pay for it. So they're saving a ton because they're getting good outcomes from those procedures.
How about like Medicare?
Medicare will probably be a few years. They're like 10 years behind everything. So governmental stuff, there's just so much tape and stuff to get through. So the cost would range for PRP from, say it's a foot, probably $400, $500. Knee joints and stuff, $500, $600 for little joints, like feet, fingers. Knees are probably more like $1,200, $1,300. And then the most probably comprehensive one is the low back, and that's probably $1,700 to $2,100, depending on the different things you have to do with it. That's for the PRP. The stem cell procedures, that's probably more, those are probably all about the same. Those are probably pricing about $55,000 to $7,000, depending on the area.
Oh, to do a knee out of pocket?
With stem cells, yep. PRP for the knees is probably about $1,500.
And what?
The PRP, which is the blood version of it, that's probably about $1,500.
So which one's going to work better?
So that's all depending on how much arthritis you have. So usually when you come in, we'll kind of look at your x-rays, look at your imaging, look at your MRI and say, wow, if you're super advanced, you might want to think about doing stem cells first. If it's kind of mild arthritis, you got some small rotator cuff tear or small little minuscule tears in there in your knee, then PRP is probably going to be helpful. So a lot of it depends on the severity of the problem. Like I said, with spine, I rarely do any stem cells on the spine unless the PRP failed. And we have really good outcomes with our spine just using platelets. Other questions?
I ask that, as far as the severity, I look at it as my break cancer worn out.
Yep.
Is there a point where it does not, where it's structural?
The only place that has decreased outcomes with severity of arthritis that we're finding are hips. So hips, once they're gone, they're hard to get back. Now, I've had a ton of patients with severe bone-on-bone, like just do it because I don't want surgery. And we've had some good outcomes with more severe hips. I'm not as scared of severe knees, ankles, and other areas, but the hips are ones that are a little bit more troublesome if it's more severe. If it's mild to moderate, that's not a problem. But hips, you got to kind of watch. Once those get too far gone, those are tough to get back. Any other questions? Anybody have a remote start in their car? I'm just kind of thinking it's going to be cold. Yep.
Do the treatments delay replacing your joint, or does it prevent it?
It's going to do both. The thing about everything is nothing's permanent, right? Even a joint replacement, a young guy like you, depending on what joint it is, it's going to give you 8 to 15 years. Now, a shoulder, on a young guy like you, I'd wait until I was 70 before doing a joint replacement. Once you have a joint replacement, your functions decrease, your ability to lift stuff is going to go down. You're going to have a lot of things you can't do. But the problem is, too, is they have a 8 to 12, 15-year half-life, right, or lifespan. If you're active, that goes down. So on a young person like you, I'd do everything possible to do a joint replacement. Now, if you were 85 and you had 5, 10 years left in your life, sure, replace it. And if you're not very active, that's a different story. But if you're young and you want to avoid that, there's a different story for you. Yep.
You talk about joints, but what about like bulge discs?
Yep. Yeah, same thing with bulge discs. Those discs are bulging because your spine is unstable. So we talked about how instability causes things to break down. If you imagine your back is like a stack of blocks, between each block is a little piece of rubber, that little rubber disc. Now, if everything was held together with duct tape and ligaments and everything is held together really tight with all those struts, your spine would never break down. It's like a stack of blocks that I've duct taped together. It's going to go in the ocean. It's going to float for 100 years. And it's never going to break down. Now, if the duct tape loosens and the segments start to shift and grind like this, or if the ligaments are loose because of whatever happened in your past, micro movement every day causes things to degenerate, causes arthritis, causes discs to start to bulge out. The only way to get that to come together is to tighten those ligaments back up, tighten up the muscle attachments, tighten up the fascia that holds that together, and take that unstable stack of blocks to suck back into place. Like having a tent. If all your straps start to loosen, the tent becomes really wobbly. You just go around, you start pulling down all those straps and tightening that back up. The tent pops back into alignment. Everything sucks back into place. Other questions? So that's called a failed back surgery, or if you're still having pain after surgery, we do those every day. Yeah, I mean, most of my patients that we're doing PRP and have scars because I've had laminectomy, discectomies, fusions. Yep, so it's not a contraindication.
So what is an initial consult cost?
It's, most things are covered by your insurance. Even most of those nerve blocks, all those epidurals that I said I did 10 epidurals today, those are all insurance-based epidurals. So consult, it's like going to your doctor for neck pain or headaches. It's all covered by insurance. All the nerve blocks that we do for headaches, for pain, those are all covered by your insurance. The only ones that are kind of not covered as much are the PRP and the stem cells. And that's where I said there's about 5 or 6 covering them, so things are shifting. But consultations, going to PT, all the nerve blocks, a lot of the initial pain things that we can do are covered by whatever healthcare plan you have based on your deductibles and those kind of things too.
Do you need referrals to come?
Usually not. It depends on your insurance. If you can, do you usually have to have a referral? Usually Blue Cross does not require referrals, but you can always call your plan in the back of the card and say, hey, do I need a referral? And usually you don't need a referral to get in. Yep. Other questions? Okay. And if anyone wants a tour, I'll go see. There might be a couple of people in the back. Does anybody want a tour? Okay, so we'll give some tours here then in a second.